I'm with Phillip Benheim from Yad Sarah. Now, Phillip, what is Yad Sarah?
Yad Sarah is an organization that helps people stay at home, recover at home, in everything from pre-birth. We provide things like little cribs and for babies and for mothers who don't need them for a very long time, so they don't have to have the expense incurred in buying them, to car seats, to wheelchairs, including to, in some instances, after we provide homes with full hospital equipment, beds, hoists, chairs. Sometimes after death, we also have the ability to take unused pharmaceutical, unexpired things that have been checked out and be able to provide that to people as well. So it runs the range, the full gamut of providing these kinds of services, solutions for health and wellness, both physical and spiritual.
And you're called Yad Sarah. What does Yad Sarah mean?
Yad Sarah is named for our founder and president, Rav Uri Lepoliansky's grandmother, who was murdered during the Holocaust. And it was established. He started out actually needing an inhalator for one of his kids, and in order to try to keep out of an emergency room, you just don't want to go to a hospital when you don't absolutely need to be in a hospital, and you want to get out of a hospital just as soon as you're able to. So he bought an inhalator, and then he saw that after he was done with it, a neighbor could use it, and another neighbor. So his father actually helped give him some seed funding for buying multiple units like this. And so it's named after Yad Sarah, his grandmother, and it's continued to help. The hand, the Yad, means hand and is a giving hand. And this is all about giving, both on behalf of the volunteers and the others. And every giver needs a receiver, and this is true of people who actually need the equipment, of the volunteers who work here, and very importantly also the people who donate. People who donate really want to know that their donation is going to a place that can best use it. And every giver needs a receiver. And we're an organization, because of the volunteers, where 95% of your gift goes to the intended cause.
And are you all over Israel?
Yes, we have 120 branches. We're in just about every single hospital in every area that runs the gamut of the country. Our first branch was in the living room of Rabbi Lepoliansky. That still continues to this day. That's branch number 1 out of 120. And what we're doing also more recently, and COVID helped accelerate that, is building big distribution centers around the country, and we're doing more and more and more home deliveries. When people are able to get to us, they get to us, but if not, we get to them. And this way we keep much more equipment locally instead of one big distribution center. We now keep it a lot closer to the end user. It's required us acquiring more equipment, but it's more readily available to the user.
Now, you're run by volunteers. How many volunteers do you have in the organization?
Approximately 7,000 volunteers in the organization. As Rabbi Lepoliansky likes to say, it's an organization for volunteers that we found for them to be able to give.
How many people receive help annually here?
I would say it's approximately, right now, about 750,000 receive on an annual basis. According to the figures that we have, I would say a little bit over 80% of the entire population has used Yad Sarah services over the years. There's nary a household that doesn't use, need, or will not use or need Yad Sarah services.
So if I have a medical problem, I could just come here and ask, do you have such and such, and then you're able to provide and help in that service?
Clearly, and not just a medical equipment problem, but like I said, a full range of services. But you don't need to get here. If anybody who has internet access can see it online, you can order online, you can have products delivered, or you're welcome to any one of our lending centers.
Do you look after Holocaust survivors as well?
Oh yes, as it turns out, Holocaust survivors are amongst the more aged population here. We don't discriminate in the aged population, but it turns out that we, more than any other organization that I'm aware of, including claims conferences and anybody else, deal on a direct basis with Holocaust survivors. We're there for them in a range of full gamut of services. We reach out to them. For example, we do life stories that help them. We offer a service of free legal services. Very often these people are either they don't have the wherewithal or don't have the contactability, and we help them to make sure they're not taken advantage of by whether it's landlords or anybody else. We provided service for those people to be able to get their vaccinations during COVID. The government didn't provide for that, and we sent one of our Yad Sarah vans together with a helper and together with equipment to be able to get these people out of apartments. Very often they're in apartments with no elevators, and they're stuck in their apartment. We got them down. We got them for both their vaccinations back and forth, together with an accompanier. And so, yes, we very, very much deal with that population.
Now, your volunteers, are they from all sorts of faiths and walks in life?
Yes, every faith and walk in the country. We have, whether they're Druze or Christians or the Jews, and whether they're white or they're colored or they're Asian. We service the entire population, any age, race, creed, color, without exception.
How does your call center help people?
First of all, it's there to help guide them and direct them properly within the Yad Sarah organization. It includes an emergency service here, which has grown now by tens and tens of thousands of people that we offer emergency service to people's home for a nominal fee. If you're able to, only for a deposit. In many instances, is all we seek. And that's a number that you can either press a button that's on your wrist. We also offer now a hanging device that you can wear around your neck. And that's passive in that if you fall, which happens to people, not necessarily only older people, although it happens often, and very often you're all alone. You know, when it happens on the street, Israel is very giving, and lots of good Samaritans will help you. But when you're in the privacy of your own home, very often alone, you have nobody. And so this device sends out a call signal to our service. They immediately contact you through a device, automatic remote device that you don't have to activate. And then we call, whether it's police or ambulance or next of kin or your next door neighbor, to see how we can help and provide service to you.
Wow. So this device actually knows when you fall and actually calls for help at the same time?
Exactly. I think it gives about 15 seconds in case it happened by accident. But if you don't deactivate it, the default is activated rather than the other way around. So you don't have to positively activate it. It's self-activated, and it makes that phone call. And then we take over from there.
Tell us a little bit about your play center for children with special needs.
We offer, again, many, many services here. We have something called the Shikumon, which was mostly closed down during COVID. We're now opening them up again. This provides services for kids of multiple needs. We have something, again, which we created here, which is called a Mischakiya, which is a play center, but it's really all about therapy, and it's about working psychologically together with the parent and the child at the same time, and to give them guidance as to how they can activate, because very often what Uri discovered, is that very often kids are sent to different places, institutions, and things like that, and they don't have the family contact. What's important for us, again, is all about keeping people at home. So we provide the service here, and they are taught how to interact and interplay together with their kids, and to maximize that kind of service.
Where would people be without the help and support of Yad Sarah?
We think far worse off than they are. We believe, certainly during COVID, we think we've actually saved the lives of close to 30,000 people based on the number of oxygenators that we delivered to people's homes. It's something that kept people out of hospitals. We had the visit here from the head of the Shaare Zedek Medical Center, who said if not for Yad Sarah, they would have reached their overcapacity a lot earlier, and people clearly did not survive that. There were deaths as a result of that problem. And because we were able to deal with that early on, Uri Lopolyansky saw that at the outset of COVID, and he placed orders for thousands of oxygenators. Also placed orders for tens of thousands of pulse oximeters, because he learned medically that in about 60% of the cases, the first indicator of COVID was decrease in your blood saturation level. So for the sake of a $20 device, which was lent here for nothing, like most other things in Yad Sarah, you were able to take your, before you had an onset of any of the other symptoms, again in 60% of the instances, not 100%, and you knew then that you had a good likelihood of the onset of COVID and can place. Recently, we've actually seen an increase of about 24% of the calls for oxygenators in the last few weeks, which is an indicator to us of what some other countries are either denying or haven't caught on with yet, that there is a definite increase in the need. And the numbers are starting to demonstrate what we already saw weeks ago.
So Yad Sarah was able to really respond positively to COVID.
Oh yes, quite positively and quite rapidly, and try to stay ahead of the curve, which is something that we try to do in every instance. We try to recognize a need early on and offer the solution before other people can wrap their heads and their arms around it.
Did you give out a lot of oxygen machines?
Yes, thousands and thousands and thousands of oxygenators. We actually recently were able to, as we were replacing them, we were able to lend equipment to the Indian government. And we made a number of shipments to India where they couldn't get a hold of this. I actually saw a news item in the UK when we sent, say, over 1,000 items. I saw a great big statement from the UK government. I think they were sending 300 or 400 oxygenators to India when we were quietly sending over 1,000. We, Yad Sarah, versus the entire UK government at the time. Nobody's comparing, but it just shows you, our abilities and answering to needs and promptly.
You have more equipment here than the hospitals in Jerusalem?
I think the numbers are we have more equipment here than all the hospitals together in the state of Israel.
Wow.
Between all our other branches of that kind of medical equipment. I think we buy more beds than anybody else does, and more special chairs and hoists, and we're constantly purchasing. And yes, those are the numbers.
Now you were rated a 4-star charity by Charity Navigator. You must be proud of the way that people are recognizing you as an organization.
Yes, the Friends organization in the U.S. has a Charity Navigator rating. We as well both have Gold Star ratings, and we are very proud of that. And we have, there's a lot of support for us. And again, people who give to us, they like to look for organizations where close to 100% of their gift is going towards the needy, towards the intended recipient, rather than get all caught up in overhead and administrative costs. And so, yes, I think that's a big part of the kinds of ratings that we get.
What's your annual budget to run an organization like this?
It's relatively low. I would say it's approximately $50 million, $50 million. If not for the 7,000 volunteers, I would say that number would be probably 10 times that amount. I think the value of our volunteers is somewhere in the neighborhood of about $400 to $500 million in value. And that's a relatively low cost for the kinds of services we provide. On the other hand, we do, and the majority of that is covered here in Israel with little gifts from 18 shekel to 1,800 shekel to larger gifts. Most of our capital fundraising, though, has come from overseas, and it's growing here within Israel, too. We're, for example, now putting up a huge new 15-story facility in Jerusalem, which will have 220 accessible rooms available for people as soon as they can be released from hospitals, where they are prepared both in terms of therapies and in terms of therapeutic assistance and nutritional assistance, places for them to stay to make them ready to be able to go home in their home environment. That facility, for example, has a cost of approximately $70 million, but it's almost entirely up. We've had it already arranged for financing, but we, of course, need to fundraise for that and then to be able to provide that to the people of Israel.
You must have touched many, many people here. Do you have stories of people's lives who've been changed because of the work that you do?
Every single day. I would direct you to our website. We have a number of stories, and they run the gamut from a story just heard from about somebody who was stuck at home. The wheelchair didn't fit into his elevator, and they turned to Yad Sarah, and we retrofitted a wheelchair that both accommodated the person's girth as well as the restrictive dimensions of the elevator, so he was able to get out. Another story happened just, I think, 2 weeks ago. I heard in Shaare Zedek Hospital. There was a Haredi fellow, an ultra-religious user who came to borrow a piece of equipment. He didn't have all the money needed for the deposit, because we don't charge for the chair, but we do, or whatever the item was, I think it was a chair for the deposit. And he stepped aside to call his son to see about getting a credit card that could otherwise accommodate it. In the meantime, there was a person behind him who then returned his item, and he actually left the deposit as a donation, which fortunately a lot of people in Israel do who have the ability to do that. They leave either part or all of their donation. So he left the entire donation, Yad Sarah. He then turned to this person and asked what the problem was. He said, well, I have trouble coming up with the amount of the deposit. So he said, so let me cover the deposit. He said, no, I don't want to take anything from you. He said, well, you're not taking from me. He said, when you return the item, you make sure that you leave that full deposit for Yad Sarah. It just happens to be that that person who helped him was an Arab and helping an ultra-Orthodox person. And that really captures the story of Yad Sarah. Every single day, it's people talk about the working within the population here. This is where you see it happen every single day, whether it's Druze-operated facility lending to Jews and Jews to Druze, or to Christians or anybody. Here you had just turns out an Arab citizen helping an ultra-Orthodox citizen, and Yad Sarah was the common denominator.
Why do you do what you do?
Actually, my family's been involved with Yad Sarah for over 40 years. Turns out my mother founded Friends of Yad Sarah in America. Our family's been involved helping, from some bring equipment in the early days, and I would try to help fundraise for the organization. To the chagrin of some of my grandchildren and grandchildren, we've been doing these pickups and those drop-offs. I've ended up, instead of spending a few minutes or a few hours, I now spend full time trying to help the organization fundraise worldwide and to try to manage our friends' offices, and as well, we're trying to help establish Yad Sarah type models around the world. I had a call recently from Bahraini government. We're trying to help them do something over there. I just is now in touch with the Tanzanian government to see how we can help over there. This concept and how to put it in place to make it work is part of my role and responsibility here, and I do it with love.
This is Israel being a light to the world, isn't it?
In this case, for sure, I can speak. There are other areas too where I'm not the best one to speak about it necessarily, but certainly in this instance, it is very, very much something. In fact, there's a person who was here a couple of years ago. His wife fell and needed a wheelchair, some crutches. Fortunately, it wasn't a sickness besides that. He then discovered Yad Sarah. Somebody told him where he can go immediately because the doctor didn't have any facilities for him. They went to Yad Sarah, borrowed equipment. He loved it so much that he established an organization actually in the States, in Connecticut. It's called Wheel It Forward. You can look him up, which is modeled after Yad Sarah. He's somebody who was in the finance business who decided to give of his time and his resources. And this story repeats itself. And we're in touch with him to try to help him as best we can. And it's just all about giving. And you can see the benefit of this in organizations. It's just, it's uncanny. It's incredible. And in this case, we have been a light, and we continue to be a light, and we're offer our assistance wherever we can.
What's your prayer for the future?
The prayer is just to continue going and growing, and hopefully as the government steps in and provides the kinds of services that we think they should be providing, we're happy to step back in those areas and look to fill the needs as they come up. We're forever, Uri has a vision, and as soon as we identify a need, we jump in to service it. That new health and wellness center that I described is a need that the country has been begging for, but nobody has answered it. There on any given day, pre-COVID, there were about 700-800 people in hallways in hospitals in Israel. This 220-room facility, if somebody stays there on average a week a year, there are 10,000 room nights a year that can be accommodated here for people. And this is what the country needs. It's not answering it itself, so we're going to be the answer for that. When somebody needed service to be able to transport wheelchair-bound people, Yad Sarah answered that. Today, as there are other options available, we're reducing that. We're increasing the needs as we see needs, we're increasing it. So it's Yad Sarah's vision that the government does more and more. We'll do less and less in those areas where they do more and more, and then we'll do more again in other areas and other needs that have not yet been identified. And if they have been identified, they haven't offered solutions.
What's your website for people who'd like to know more?
In Israel, it's yad-sarah.net. In the UK, it's yadsarah.org.uk or Friends of. In the US, it's Friends of Yad Sarah. But if you just Google Yad Sarah, a couple of them will pop up, and you're free to use it. And there you can get a gist of our services. The Israeli site is more user-based, because here the people are using the equipment, so you'll have there your list of equipment and what's available to be borrowed. We also offer for sale at a fraction of the cost that other people do it, because we don't look to do it for a profit. We add a nominal percentage just to cover a little bit of overhead, but for the most part, it's at a fraction of the cost of what these things would have cost to be acquired for people who want to have their own item. And they've had the full range of equipment, again, hundreds and hundreds of pieces of equipment that we've discovered, that we acquire inexpensively, and we offer it inexpensively. And the other sites are more about the services that we offer here in Israel and what we offer to overseas people that they can book through the website. We offer for wheelchair-bound people tourist services. We offer our vehicles and hook you up with tour guides if necessary, and help you with your accommodations if you get a hotel room, and we'll make sure that it's fully complemented with all the equipment that you might need that Yad Sarah can lend.
Okay, Philip, thank you very much.
Thank you very much for the opportunity and for spreading the good word and for the good work that you folks do.